Well, thanks very much to the APA for inviting us to speak. We're really excited to talk more about Get Healthy Philly, and I'm excited to get to co-present with Allison, my previous coworker and current collaborator, and Clint, my current coworker. So I'm going to talk a little bit about Get Healthy Philly more broadly and the work that the Philadelphia Department of Public Health is doing around obesity prevention, chronic disease prevention through healthy food access. So I'm going to give intro to Get Healthy Philly, talk about some of our key strategies in our food access mapping, and then Clint's going to talk in more detail about the planning policy work that he's been involved in. So Get Healthy Philly is an initiative that's funded through the Communities Putting Prevention to Work program, the federal program through the Centers for Disease Control and Prevention. So Philadelphia got awarded a $25 million grant in March of 2010 to do this work, and it's $15 million towards obesity prevention and then $10 million towards tobacco. And the obesity prevention work is focused on both healthy eating and active living. So there's two components to it. So I'm going to talk first just about the challenges of obesity and why we felt that this work was really important. So to start, so this is one of the challenges. This is the KFC Double Down sandwich, and it's 2 fried chicken patties as the bun with bacon and cheese on the inside. So this weighs, this has 540 calories, 32 grams of fat, and 1,380 milligrams of sodium. And they also offer a healthier grilled version, but that is just as bad and has mysteriously more sodium with 1,430. So this is just, some of the things that people are up against and some of the things that make it hard to have healthy behaviors. And this is another thing. Food marketing of unhealthy foods is available everywhere, disproportionately available in some neighborhoods, and the amount of money spent on food marketing of unhealthy food is, hundreds of times more than public health marketing for healthy eating and active living. And this is a corner store, not necessarily in Philadelphia, but there was a survey of inner city children in Philadelphia corner stores, and it showed that elementary school kids often buy chips, candy, sugary drinks twice a day, which adds an extra 3,500 calories a week to their diets. So for $1, a child can buy 360 calories of food and beverages. And they can buy an 8-ounce beverage, a single serving, a bag of chips, an assortment of candy and gum, and a popsicle, all for $1. So that's something else we're up against. And then just to briefly mention the physical activity, active living side, because it is a large component of the work as well. There's auto-based planning, as I'm sure people on this call know just as well as I do, that makes it hard for people to walk and bike and use active public transit even if they want to. There's some challenges in the physical environment that we need to address. So this is just a summary of some of the things I just said, the key determinants of obesity: poor diet, limited access to healthy foods, aggressive marketing of unhealthy foods, higher relative price of healthy foods compared to that $1 that you can get all those things at the corner store, and then lack of physical activity. And this is how it can play out on the ground in Philadelphia. This shows just adult obesity and overweight. And for children, obesity and overweight, 46.9% of the children in Philadelphia are overweight or obese. So there's definite challenges that we're facing here. And poor diet and inactivity are the second leading cause of death for Philadelphians, and there's 22,000 deaths from those causes in Philadelphia since the year 2000. It's 2,000 deaths per year approximately, and about $750 million annually in healthcare costs. So, the reasons I just said: increased caloric intake, lack of fruit and vegetable consumption for a variety of reasons, including, access in terms of affordability, availability, and, physical awareness and knowledge of how to get those resources. So, and obesity is not just a challenge in itself, it's more the risk that it poses for these other health outcomes: type 2 diabetes, hypertension, and other diet-related diseases. So, given all of that, how can we make it easier for people to engage in healthy behaviors? This is the model that we're using through Get Healthy Philly, which is trying to make it to change the default option. Thomas Frieden from the CDC uses this, and we like this model a lot, thinking about making the healthy choice the easiest choice and the default choice that people have, so that it's easier for them to have access to this healthy, affordable food and to be active. And the way that we're approaching this is to work across many different departments within the city, work with as many external partners as we can in a variety of different ways. So these are different circles representing, the different components, but there's obviously a lot of overlap between built environment and community food access. Institutions such as schools and after school, and workplaces, and the media and policy, of course, is overarching all of those things. So in Get Healthy Philly, these are sort of the three themes that we're looking at. It's increasing access to healthy, affordable foods, decreasing the availability and consumption of unhealthy foods, so they sort of go hand in hand, and enhancing opportunities for safe physical activity. So I'm going to talk a couple minutes about the strategies for increasing access to affordable, healthy foods that are happening on the ground. So we've been working with the Food Trust on coming up with 10 new farmers markets that are in low-income communities. 4 were started in 2010, and then another 6 are planned for this year. And we're not only having these farmers markets created, we also started a Philly Food Bucks program, which is sort of like a double value program. So people can use their food stamps, their food benefits at the market, their SNAP access cards, and if they use, for every $5 they spend at the farmer's market, they get an additional $2 coupon that you see here on the screen for fruits and vegetables specifically. So it's been a pretty popular program in the first year. It increased SNAP sales significantly, over 100%, and we're still trying to work on pushing that number more. And we're working with community partners to get the word out about the program and to connect it with nutrition education. So it's not just educating about food, it's also helping them increase their buying power so they can get it, and to connect them to the farmer's market and make them know that they can use their food benefits there.
Amanda, sorry to interrupt. Can you just tell people what SNAP are?
Oh, sorry. The Supplemental Nutrition Assistance Program, which is formerly food stamps, so it's the federally funded program for lower income people to give them benefit cash per month to be used for the purchase of food. And it's called SNAP, and it's an access card. It's the actual electronic card that is almost like a credit or debit card. And through the work of the Food Trust and Farm to City and other groups in Philadelphia, a lot of the farmers markets in Philadelphia already have the capacity to accept food stamp or SNAP benefits at the markets. So that was a really great infrastructure that was already in place that could help with this program. So we're also working in a lot of corner stores, and I'm going to show you a map of the farmers markets and the corner stores in a moment so you can see their distribution across the city. But we're working with over 500 corner stores through the Food Trust and the Healthy Corner Store Initiative. So 500 are sort of at the first introductory level, so they're introducing at least 2 new products in 2 different product categories. And then there's going to be a smaller number of corner stores, up to 100 though, that will be able to have mini grants for infrastructure capacity, so like storage, like the refrigerated unit you can see here, so that they can be better able to provide fruits and vegetables and other healthier products like lower fat milk and whole grain bread products in the communities of need. And then we're also looking into a produce cart program similar to the New York City Green Carts that would be looking at the areas that that still have need and aren't currently being served by the farmers markets or corner stores, or could be connected with them in some new ways. And we're also thinking about ways to connect that to our health centers. So this is just a couple of the community food access components that we're working on. And just so you can see a map, we're lucky to have a geospatial analyst on staff who does really great mapping for us that I'm going to go into more detail about. And it's really helped to inform our decisions about where we should focus our efforts and also measure how we're doing. So on the left, you can see the total corner stores in Philadelphia, which is approximately 1,500. And on the right, you can see that over 500 are enrolled at that level of introducing new products. And then for the farmers markets. This shows all the farmers markets in the city that we know of at this point. And then if they're blue, they accept SNAP, the benefits I talked about earlier. If they have a dollar sign in them, they also accept the Philly food bucks. And the ones with the cross or the check behind them are the ones that we've created through this initiative. So this shows the 4 that were started last year, and I think 4 for this year, and then 2 are still to be determined, the locations. And we're hoping to also partner to locate these markets at a couple of them at transit hubs where possible, so that the access is greater. And then I just wanted to say really broadly, we're also, besides these on-the-ground community food access initiatives, we're also doing a big media campaign, and it's focused on making the connections between the consumption of sugary drinks, obesity, and the risk for diabetes, especially for younger children. So on the top left is a screenshot from the TV ad that we had, and the bottom right is from our transit ads. So we have on it in bus shelters, bus stations, on the subway, and there's a texting interactive component so that people could actually text in and get responses to different questions we had, or they can opt into an ongoing program where they can get more information about healthy drinking and eating. And on the right is we did a vending policy for the city, the vending machines within the city, to help tip the balance a little bit more towards healthier drinks. So water, 100% juice, and making portion size more right-sized. So if there's questions about that, I'm happy to answer either in Q&A or email, but I just wanted to mention those 2 as well. So what I'm really going to talk about in more detail is our food access mapping. And like I said, we have a geospatial analyst who's been doing a really great job trying to bring together all of this information. And Clint's going to talk more about how he's going to use it in his work as well. But I'll just walk you through the methodology. And it's still evolving. It's a process. But this will give you a sense of what we're thinking at this point. And as I said, it helps to inform our placement of the on-the-ground interventions, the corner stores, the farmers markets, helps to inform the planning and policy decisions, and it also will help us measure, the current need and our progress as we're going forward. So these are the 18 planning districts in the city of Philadelphia that were recently created. And I'm going to just walk you through the mapping looking at the lower north planning district. So this is a zoomed-in shot of the lower north planning district. So we took supermarket data from paid sources, and we mapped them. And all of these different food retail sources are going to have different points, and that's going to add up to the walkable food access score. We're focusing on walkability for this at this point because we want to see, because transportation and food access, if it takes a lot of time, or if you have to change bus lines, or if you have to get a car to get to a food retail establishment, that can increase the cost of food. So having healthy food in a walkable distance from you is effectively making it more affordable. So we're looking at supermarkets, and we gave them the highest score based on their diversity and assumption that they have a wide variety of products at a range of prices. We also assigned a walk shed to them of half a mile, because we assumed people would be able to want to walk a half a mile to a good supermarket. And next is mid-size, and supermarkets we defined as 2 million or more in sales. So mid-size supermarkets is 1 million to 2 million in sales, and has a walk shed of a quarter mile, and it's 20 points. Corner stores, there's a couple different kinds of corner stores on this slide. There's chain convenience stores, which we determine based on their franchise code, and they're usually Wawa's, which is a local convenience store chain that has a large amount of food and deli, and 7-Elevens. And they have a walk shed of a quarter mile and 4 points. And then there's the corner stores in the Healthy Corner Stores network, and they have a walk shed of a 1/10 of a mile. So there's healthy corner stores, which are 2 points, and then the that higher level conversion corner store that would get the infrastructure mini grant, they're 4 points. And the ones that are the different colors are the conversion stores. All of the corner stores on this, if they're not convenience stores, are in the Healthy Corner Store network, and the purple ones are the ones that have received grants. And then farmers markets have a relatively lower score based on seasonality and operating hours, but we're thinking about possibly, if it's a year-round market, changing the score. So as I said, the scores are in flux right now, but currently they're 2 points and a walk shed of a 1/4 mile. And the one with the square around it is one of the ones that we started through Get Healthy Philly. And then we're also looking at produce carts. So these aren't the produce carts that have been started yet through our initiative because that's still getting underway. They're ones that are currently licensed through the health department, through our environmental services division here. So then when you look at all of this together, you get the aggregate walkable food access score. So the green has the highest access score with over 50 points. Yellow is moderate, orange is low, and red is no walkable access. And when you take the low to no access, the red and the orange, and overlay it with areas of higher poverty, then you get the target areas. And high poverty for this purpose means 60% or more of the households in a particular area are below 200% of the federal poverty line. So this is what it looks like at a citywide level. And as I said before, this mapping is used when we choose the farmers markets, the corner stores, the healthy carts, and when we're thinking more broadly about policies and planning.